Dr. David Allen, and you know, as I've sat here, I recognized that this is how I felt in the 1980s when I saw this massive epidemic coming upon our country. And still connecting to the US, as you know, we did a lot of publishing on cocaine. And the thought that we have two young psychiatrists who are ready and willing to deal with the urgent need around us. And as Dr. Diller says, what happens in the US comes our way as well. But they're ready. They have a facility. And, you know, maybe Dr. Diller and Dr. Christie, you could tell them some of the symptoms that people would know, because we don't know much about this. What are some of the signs and symptoms people should look for if somebody's got an opiate addiction?
Some of the symptoms to look for are what are called physiological effects of the opioid drug. Certainly the patient may, or the person may complain of sluggishness, feeling on the nod, being slowed down. There may also be present neurovegetative symptoms such as decreased appetite. Also, there may have been weight loss with respect to the loss of appetite. The person may be observed to be yawning a lot. And also in terms of the drug-seeking behavior, there may be a history of absenteeism, loss of functioning in life arenas in terms of their family functioning, social functioning, and other arenas of life. And also persons doctor shopping, where they are shopping around. They may have a vague complaint, but they're going from one doctor to another doctor with complaints of pain in one or more systems of the body, whether it be the chest system, the heart system, the musculoskeletal system. So it's called doctor shopping, and it's a way of accessing the opioid medication, or in more clinical terms, polypharmacy, where they're shopping around to get multiple scripts for the drug that they prefer. And this is called the drug-seeking behavior. And there are people who would take risks to have access to the prescription in terms of lifting a script from the doctor's office and forging the signature of doctors. And so it is really good to note that these persons do have an addiction when they have entered this type of at-risk behavior. And this is a classical sign of drug dependency.
Just to add to, that goes for many drug addictions as well. We've spoken about opioids, but let's not forget about the issues with cocaine, alcohol, marijuana, and many other
So Rejuvenate
drugs.
would be open as an addiction center? Yes. And what addictions will you deal with in Rejuvenate?
Absolutely. So many
Which ones you'll deal with?
Yeah, so alcohol, cocaine, marijuana, opioid, amphetamines, all of those addictions, as well as behavioral addictions like gambling addiction, sex disorders, many issues that we are able to assist, as well as the primary psychiatric disorders as well, like schizophrenia, bipolar, major depression, post-traumatic stress, etc.
Well, I want to congratulate you both for your creative approach to doing something really new in our country. And fellow Bahamians, we need to support them. One question I have, let's say I come to your center. I have a doctor who, you know, I like very much, and he's been treating me. Can my doctor continue the treatment once I'm in your center?
Well, we do have relationships with our physician colleagues, so we would certainly have consultation with the treatment team that the person may have previously had, and look at ways in which there can be continuity. So it's just a matter of us having communication, finding out what is best for the client, for the patient, and we will do our best to ensure that they're as comfortable as they possibly can, and that the transition is seamless.
And Dr. Christie, if somebody's on your unit and has a medical problem, how will they get help? Because you know you guys are psychiatrists.
Yeah. We have our physician colleagues attached to Rejuvenate Bahamas in terms of them being experts in their areas, in terms of critical care specialists and other medical internists. And so they're able to help anyone with an underlying medical problem such as diabetes and or hypertension or other blood disorders.
And anyone who's admitted to Rejuvenate Bahamas is thoroughly medically screened. So that's one of the inclusion criteria where persons are appropriately medically screened and any general medical condition is stabilized or being addressed while they're staying with us. So that's a part of their package.
Well, as we come to the end of our program, I'm going to ask each of you to say a word to the public. Dr. Christie, what would you like to say to the Bahamian public listening to you tonight?
Yeah, the overall aim of Rejuvenate Bahamas is to treat persons suffering with major mental disorders, such as primarily the drug use disorders and other behavioral disorders. And we want to do it in a confidential and anonymous manner. And we have specialists in every area in terms of the conventional medicine and the holistic treatments that we are offering at our center. If you have any questions, you can email me at info@rejuvenatebahamas.com, or you can call me and leave a message at 327-3633 and or 327-3634. And I'll be happy to help you to answer any questions that you may have.
Dr. Dillett?
Well, Dr. Allen, what I would like to say is I'm proud to be a Bahamian, and I'm proud to know that a collection of professionals and individuals can come together, whether it's doctors, nurses, psychologists, that we could come together and do something that we can be proud of, that could stand up to any facility anywhere else in the world, North America, Europe, and everywhere in between. And so I would like for the Bahamian public to also be proud, to know that there are persons out there who are dedicated to improving healthcare in this country, to provide the services that are not only demanded, but are deserved by the Bahamian people. And so please help us to help you, and any questions you have, as Dr. Christie said, we're more than happy to answer them. But I'm just proud. I'm just proud that I could live to see this day and to carry on the baton of those distinguished people like yourself who have come before us, and hopefully that someone will be coming behind us to carry it even further. So I'm proud to be a Bahamian, and I want the Bahamian public to know that Dr. Christie and we are dedicated to improving mental health care in this country.
Well, I want to thank you both for being so creative and so industrious to go ahead and think ahead to help us in this very important area, because Bahamas has never had a private treatment facility. Many times I've had to use a room in my office to help somebody, and now we have a proper unit developed by Dr. Christie and Dr. Dillett. Congratulations.
Thank you, sir.
Thank you, sir.
Good night.